Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A 2-year-old child is admitted with dehydration due to vomiting and diarrhea. Which assessment finding indicates severe dehydration? A. Moist mucous membranes. B. Sunken eyes and delayed capillary refill. C. Normal skin turgor. D. Urine output of 2 milliliters per kilogram per hour. Correct answer, B. Sunken eyes and delayed capillary refill. Rationale: severe dehydration is characterized by sunken eyes, poor skin turgor, delayed capillary refill, tachycardia, and decreased urine output. Question 2. A nurse is assessing a 6-month-old infant. Which finding requires immediate intervention? A. Respiratory rate of 30 breaths/min. B. Heart rate of 130 beats/min. C. Bulging fontanelle while the infant is calm. D. Weight gain of 0.5 kilograms this month. Correct answer, C. Bulging fontanelle while the infant is calm. Rationale: a bulging fontanelle when the infant is calm may indicate increased intracranial pressure or meningitis and requires immediate evaluation. Question 3. A 4-year-old child with croup develops inspiratory stridor at rest. What is the nurse's priority action? A. Encourage the child to cough. B. Administer humidified oxygen and notify the healthcare provider. C. Give oral fluids immediately. D. Lay the child flat. Correct answer, B. Administer humidified oxygen and notify the healthcare provider. Rationale: stridor at rest indicates significant airway obstruction requiring prompt intervention. Question 4. Which finding is expected in a child with epiglottitis? A. Barking cough. B. Drooling and sitting in the tripod position. C. Wheezing only. D. Productive cough. Correct answer, B. Drooling and sitting in the tripod position. Rationale: epiglottitis presents with drooling, dysphagia, high fever, muffled voice, and tripod positioning. It is a medical emergency. Question 5. A nurse is caring for a child experiencing a febrile seizure. What is the priority nursing action? A. Place the child in a side-lying position. B. Insert a tongue blade. C. Restrict movement. D. Offer oral fluids. Correct answer, A. Place the child in a side-lying position. Rationale: positioning the child on the side helps maintain the airway and reduces the risk of aspiration during a seizure. Question 6. Which statement by the parent indicates understanding of oral rehydration therapy for a child with diarrhea? A. I'll stop giving fluids until the diarrhea stops. B. I'll give small, frequent amounts of oral rehydration solution. C. Fruit juice is the best replacement fluid. D. I'll only give water. Correct answer, B. I'll give small, frequent amounts of oral rehydration solution. Rationale: oral rehydration solution replaces fluids and electrolytes effectively and should be given in small, frequent amounts. Question 7. A child with bacterial meningitis is admitted to the pediatric unit. Which nursing intervention is the priority? A. Place the child on droplet precautions. B. Encourage visitors. C. Keep the lights bright. D. Increase stimulation. Correct answer, A. Place the child on droplet precautions. Rationale: droplet precautions help prevent the spread of bacterial meningitis until appropriate antibiotic therapy has been established. Question 8. A nurse is assessing a toddler with suspected intussusception. Which stool finding is expected? A. Clay-colored stool. B. Bright green stool. C. Currant jelly stool. D. Black tarry stool. Correct answer, C. Currant jelly stool. Rationale: currant jelly stools, caused by blood and mucus, are a classic sign of intussusception. Question 9. A child with asthma develops severe wheezing and increasing shortness of breath. Which assessment finding requires immediate intervention? A. Oxygen saturation of 88%. B. Heart rate of 120 beats/min. C. Mild anxiety. D. Respiratory rate of 28 breaths/min. Correct answer, A. Oxygen saturation of 88%. Rationale: an oxygen saturation below 90% indicates significant hypoxemia requiring immediate treatment. Question 10. The pediatric nurse is caring for 4 children. Which child should the nurse assess first? A. A child with otitis media reporting ear pain. B. A child with asthma who has absent breath sounds and increasing fatigue. C. A child with a temperature of 38.2 degrees Celsius 100.8 degrees Fahrenheit. D. A child with vomiting who is requesting water. Correct answer, B. A child with asthma who has absent breath sounds and increasing fatigue. Rationale: absent breath sounds in a child with asthma may indicate minimal air movement due to severe airway obstruction, silent chest, a life-threatening emergency requiring immediate intervention. Question 11. A 3-year-old child is admitted with acute epiglottitis. Which nursing intervention is the priority? A. Inspect the throat with a tongue blade. B. Keep the child calm and prepare for possible airway intervention. C. Encourage the child to drink fluids. D. Place the child in the supine position. Correct answer, B. Keep the child calm and prepare for possible airway intervention. Rationale: epiglottitis is a medical emergency. Agitation can worsen airway obstruction. Do not examine the throat with a tongue blade. Question 12. A child with nephrotic syndrome has generalized edema. Which nursing intervention is most appropriate? A. Restrict protein intake. B. Monitor daily weight. C. Encourage vigorous exercise. D. Increase sodium intake. Correct answer, B. Monitor daily weight. Rationale: daily weight is the most accurate indicator of fluid balance in children with nephrotic syndrome. Question 13. A 5-year-old child with type 1 diabetes becomes pale, shaky, and diaphoretic. What should the nurse do first? A. Administer insulin. B. Check the blood glucose level. C. Restrict fluids. D. Encourage exercise. Correct answer, B. Check the blood glucose level. Rationale: these are classic signs of hypoglycemia. Blood glucose should be checked immediately before treatment. Question 14. A nurse is caring for a child with sickle cell disease who reports severe pain. What is the priority nursing intervention? A. Encourage vigorous activity. B. Administer prescribed pain medication. C. Restrict fluid intake. D. Apply ice packs to the painful areas. Correct answer, B. Administer prescribed pain medication. Rationale: pain control is the priority during a vaso-occlusive crisis. Adequate hydration and oxygenation are also important. Question 15. A child with bacterial meningitis suddenly develops a seizure. What is the nurse's priority action? A. Insert an oral airway. B. Protect the child from injury. C. Offer fluids. D. Restrain the child. Correct answer, B. Protect the child from injury. Rationale: during a seizure, the priority is maintaining safety. Do not restrain the child or place anything in the mouth. Question 16. A toddler accidentally ingests an unknown household cleaning product. What should the nurse instruct the parent to do first? A. Induce vomiting. B. Call poison control immediately. C. Give milk. D. Force the child to drink water. Correct answer, B. Call poison control immediately. Rationale: poison control provides the safest treatment recommendations. Vomiting should not be induced unless specifically instructed. Question 17. A child with acute asthma has severe wheezing that suddenly becomes absent. What does this finding indicate? A. The child is improving. B. Severe airway obstruction with minimal air movement. C. The medication is working. D. The child is ready for discharge. Correct answer, B. Severe airway obstruction with minimal air movement. Rationale: a silent chest is a life-threatening sign indicating little to no airflow. Question 18. Which assessment finding is expected in a child with intussusception? A. Projectile vomiting without abdominal pain. B. Severe abdominal pain with current jelly stools. C. Generalized edema. D. Productive cough. Correct answer, B. Severe abdominal pain with current jelly stools. Rationale. Intussusception commonly presents with intermittent abdominal pain, vomiting, and current jelly stools. Question 19. A nurse is caring for a child receiving 4 antibiotics. Which finding suggests an anaphylactic reaction? A. Mild redness at the 4 site. B. Generalized hives, wheezing, and facial swelling. C. Slight nausea. D. Temperature of 37.8 degrees Celsius 100 degrees Fahrenheit. Correct answer, B. Generalized hives, wheezing, and facial swelling. Rationale. Generalized hives, wheezing, facial swelling, and difficulty breathing are signs of anaphylaxis. The nurse should stop the medication immediately, maintain the airway, administer emergency medications as prescribed, e.g., epinephrine, and notify the healthcare provider. Question 20. The pediatric nurse is caring for 4 children. Which child should the nurse assess first? A. A 6-year-old with otitis media reporting ear pain rated 6 out of 10. B. A 4-year-old with croup who has inspiratory stridor at rest and increasing retractions. C. A 10-year-old with gastroenteritis requesting another popsicle. D. An 8-year-old with a fractured arm waiting for an X-ray. Correct answer, B. A 4-year-old with croup who has inspiratory stridor at rest and increasing retractions. Rationale. Stridor at rest with increasing retractions indicates severe upper airway obstruction. Following the ABCs, airway, breathing, circulation, this child has the highest priority because respiratory failure can develop rapidly. Question 21. A 5-year-old child with nephrotic syndrome develops sudden shortness of breath and chest pain. What is the nurse's priority action? A. Encourage deep breathing exercises. B. Notify the healthcare provider immediately. C. Administer oral fluids. D. Place the child in the Trendelenburg position. Correct answer, B. Notify the healthcare provider immediately. Rationale. Children with nephrotic syndrome are at increased risk for thromboembolism. Sudden chest pain and dyspnea may indicate a pulmonary embolism. Question 22. A nurse is caring for a child with acute glomerulonephritis. Which assessment finding requires immediate intervention? A. Tea-colored urine. B. Blood pressure of 148/96 mmHg. C. Mild facial edema. D. Urine output of 1 ml per kilogram per hour. Correct answer, B. Blood pressure of 148/96 mmHg. Rationale. Severe hypertension can lead to seizures, stroke, or heart failure and requires immediate treatment. Question 23. A child with sickle cell disease reports severe pain in both legs. Which nursing intervention is appropriate? A. Restrict fluids. B. Administer prescribed opioid analgesics and encourage hydration. C. Apply ice packs. D. Encourage strenuous exercise. Correct answer, B. Administer prescribed opioid analgesics and encourage hydration. Rationale. Pain management and hydration are essential during a vaso-occlusive crisis. Question 24. Which finding is expected in a child with Kawasaki disease? A. Strawberry tongue and fever lasting more than 5 days. B. Productive cough. C. Gray skin discoloration. D. Bradycardia. Correct answer, A. Strawberry tongue and fever lasting more than 5 days. Rationale. Kawasaki disease is characterized by prolonged fever, strawberry tongue, conjunctivitis, rash, and swollen hands and feet. Question 25. A child with type 1 diabetes becomes confused and diaphoretic before lunch. What should the nurse do first? A. Administer insulin. B. Check the blood glucose level. C. Encourage exercise. D. Restrict fluids. Correct answer, B. Check the blood glucose level. Rationale. Confusion and sweating suggest hypoglycemia. Blood glucose should be assessed immediately before treatment. Question 26. A nurse is caring for a child with bacterial meningitis. Which assessment finding indicates increasing intracranial pressure? A. Increasing irritability and decreasing level of consciousness. B. Increased appetite. C. Warm, dry skin. D. Heart rate of 90 beats/min. Correct answer, A. Increasing irritability and decreasing level of consciousness. Rationale: altered mental status is an early sign of increased intracranial pressure. Question 27. A child with acute asthma suddenly becomes quiet and has no audible wheezing. What should the nurse do first? A. Document the improvement. B. Notify the healthcare provider immediately and prepare for emergency intervention. C. Encourage oral fluids. D. Reduce oxygen administration. Correct answer, B. Notify the healthcare provider immediately and prepare for emergency intervention. Rationale: a silent chest indicates severe airway obstruction and impending respiratory failure. Question 28. A nurse is assessing a child after a tonsillectomy. Which finding requires immediate intervention? A. Frequent swallowing. B. Mild sore throat. C. White patches at the surgical site. D. Refusal to eat solid foods. Correct answer, A. Frequent swallowing. Rationale: frequent swallowing may indicate postoperative bleeding and requires immediate assessment. Question 29. A child with congenital heart disease suddenly squats during play. What should the nurse recognize? A. The child is tired. B. Squatting increases systemic vascular resistance and improves oxygenation during a hypercyanotic spell. C. The child is preparing to sit down. D. This is a normal developmental behavior. Correct answer, B. Squatting increases systemic vascular resistance and improves oxygenation during a hypercyanotic spell. Rationale: children with tetralogy of Fallot instinctively squat to reduce right-to-left shunting and improve oxygenation. Question 30. The pediatric nurse receives report on 4 children. Which child should the nurse assess first? A. A child with bronchiolitis whose oxygen saturation is 85% on room air. B. A child with otitis media requesting pain medication. C. A child with gastroenteritis waiting for oral rehydration solution. D. A child with eczema requesting lotion. Correct answer, A. A child with bronchiolitis whose oxygen saturation is 85% on room air. Rationale: airway and breathing are the priority. An oxygen saturation of 85% indicates severe hypoxemia requiring immediate assessment and intervention. Comment your score out of 30 below. If this video helped you, don't forget to like, subscribe, and share it with a fellow nursing student. I'll see you in the next NCLEX practice session.